Cancer is one of the leading causes of death worldwide. But did you know that early detection and treatment can significantly increase survival rates? That's why it's crucial to be proactive about your health and get screened for cancer regularly. In this video, we will discuss the top 5 cancer screenings that everyone should consider getting, regardless of their age or risk factors. So let's dive in and learn more about how to keep ourselves healthy and safe from cancer. No one. Breast cancer screening. Breast cancer is the most common cancer in women, but regular screenings can detect breast cancer early when it's most treatable. One of the most effective breast cancer screenings is the mammogram. Mammograms are XR images of the breast that can detect small tumors or abnormalities that may not be felt during a physical exam. The American Cancer Society recommends that women at average risk begin getting mammograms at age 40 and get one every year. However, women at high risk may need to start screening earlier and more frequently. It's essential to talk to your doctor about your individual risk factors and the appropriate screening schedule for you. In addition to mammograms, women can also consider getting breast ultrasounds or using breast MRI as a screening tool. These tests may be particularly useful for women who have dense breast tissue or are at high risk of developing breast cancer. No. 2. Colorectal cancer screening. Colorectal cancer is the third most common cancer worldwide, but it's also one of the most preventable and curable cancers when detected early. Colorectal cancer screening tests, such as colonoscopies, are recommended to begin at age 45 for people at average risk, although this may change in the future. During a colonoscopy, a long, flexible tube with a camera attached is inserted into the rectum to examine the entire colon. This test allows doctors to identify and remove any precancerous polyps, which are small growths that can develop into cancer if left untreated. There are other colorectal cancer screening options available, such as CT colonography, which uses a computer-aided system to take pictures of the colon, and the fecal occult blood test, which detects the presence of blood in the stool. While these tests are less invasive than a colonoscopy, they may not be as effective at identifying precancerous polyps. Number 3. Cervical cancer screening. Cervical cancer is a type of cancer that occurs in the cells of the cervix, and it's the most common cancer worldwide. Regular cervical cancer screenings can help detect precancerous changes in the cells of the cervix, allowing for early treatment and prevention of the disease. The most common cervical cancer screening test is the Pap test, which involves collecting cells from the cervix for examination under a microscope. The HPV test, which detects the human papillomavirus, can also be used to screen for cervical cancer. Regular Pap tests are recommended to begin at age 21, and the frequency of testing depends on several factors, including a woman's age and previous test results. It's important to note that cervical cancer is preventable through vaccination against HPV. No. 4. Prostate cancer screening. Prostate cancer is the most common cancer in men, and regular screenings can help detect the disease early when it's most treatable. One of the most widely used prostate cancer screening tests is the prostate-specific antigen, or PSA test. The PSA test measures the level of a protein called prostate-specific antigen in the blood, and an elevated level may indicate the presence of prostate cancer. However, it's important to note that a normal PSA level does not rule out the possibility of prostate cancer. Other screening options include a digital rectal examination, which allows the doctor to feel the prostate for any abnormalities, and prostate biopsy, which involves taking tissue samples from the prostate for examination under a microscope. Men at high risk of prostate cancer may need to begin screening earlier and more frequently. Number 5. Lung cancer screening. Lung cancer is the leading cause of cancer-related deaths in the United States, but early detection can improve treatment outcomes. Low-dose computed tomography, or LDCT, is a type of CT scan that uses very small amounts of radiation to create detailed images of the lungs. This test is considered the most effective screening tool for lung cancer in high-risk individuals, such as current or former smokers. The National Lung Screening Day program recommends that people at high risk of lung cancer undergo annual LDCT scans. In addition to LDCT scans, doctors may also use positron emission tomography, or PET scans, to detect lung cancer. A PET scan is a type of imaging test that uses a small amount of radioactive material to show areas of increased metabolic activity, which may indicate the presence of cancer. Getting regular cancer screenings is one of the most important things you can do to keep yourself healthy and prevent the disease. By being proactive about your health and talking to your doctor about the appropriate screenings for you, you can increase your chances of early detection and treatment if needed. Remember, knowledge is power when it comes to your health. So stay informed, stay proactive, and stay healthy. If you found this video helpful, please like and share it with your friends and family. You can also subscribe to our channel for more health-related videos. Thanks for watching.